Welcome back. Labour Minister Thulas Nxesi has issued a new directive regarding the vaccination of employees at a workplace. This will mean looking at risk assessment while not infringing on employees' medical and constitutional rights. For more on this, let's talk to Tibor Sana, who is the Chief Inspector for Occupational Health and Safety at the Labour Department. Thanks for your time, Tibor. We appreciate it. So first off, government was very clear in its message initially that people will not be forced to vaccinate. But what are the rules when it comes to the workplace?
Thank you very much. I think you raise a very important point, and there is a process that the employer will have to engage in with both the employees as well as obviously where they exist, organised labour. And it's not a case of employers unilaterally making decisions around the vaccinations and employees are just going to have to toe the line. I think, as you quite correctly said, the latest direction includes a process which says that the employer will have to go and do a risk assessment within a 21-day period after the coming into effect of the direction that was just published. So what that entails, of course, is looking at what exactly is the workforce that the employer has before the decision is made around whether or not people are going to be vaccinated and who's going to be vaccinated. Your industry, you will appreciate, for healthcare workers is different to your industry for food and beverage, or your retail and wholesale sector, and so on. Your international, your people who are flying internationally as air hostesses and others, of course, have a different set of rules when it comes to the decision making that is required by an employer. So these factors will have to be considered by an employer before the final decision is made. Of course, the operations for that particular organization is quite important and will have to be considered as well within the bigger picture of the whole vaccination issue. But nowhere in this direction does it say that employees will have to be fired in order, if they don't take the vaccination. Yeah. Employers will be required to obviously accommodate employees as far as possible, in the decision-making process.
So there's no blanket rule or guideline that says if you are in an essential service, like let's say people who work in grocery stores, and you don't want to get vaccinated, that the employer can force you to get vaccinated, because those are people who are, of course, dealing with scores of people daily.
Yeah, look, the issue that you raised right at the beginning of your discussion, of course, which is quite important, is that there are grounds for refusing the vaccination, which could include your constitutional right as well as your medical grounds, and those are quite far-reaching. However, that said, the type of business that the employer is in is going to play an important role in the final decision, of course, around this. And again, I go back to employers will have to accommodate employees, as far as possible. And these decisions that get made will be made where they exist with organized labor.
It leaves lots of room for people taking this matter to court, obviously, because of constitutional rights being infringed on versus a company's responsibility to make sure that their workers are safe, especially if they're dealing with members of the public. Is there any process or any mediation that the department will have to provide before it gets to that point?
Not necessarily from the department side, but there is a process that can be followed between organised labour and organised business, where sectors are making the decision, such as your retail and wholesale sector. Of course, employees and employee organisations will sit together in order to make, to make the type of decisions, the important decisions that need to be made. I need to draw the attention of your listeners to what we call Annexure C at the back of the direction, which provides the foundation for decision-making, both by the employer and everyone else, including the courts, in order to ensure that fairness will prevail when making the type of decisions that need to be made. So there is a guideline, Annexure C, which is attached to the document. Again, this particular document, throughout the entire document, you'll see that there are, it's not just a unilateral decision. It does provide a framework within which to work in order to ensure that a fair process is being followed. And it is fully inclusive. For example, you'll see that the health and safety representatives, the health and safety committees, I've indicated several times now, your organized labor and so on, who is involved in the decision-making process. And these things obviously could go as far as your CCMA and also your bargaining councils. But again, there's a framework in Annexure C to assist them with whatever decisions they need to make.
So more importantly, and without even getting into Annexure C in too much detail, because I'm sure people will read that when they are actually dealing with this situation, a company cannot go to a worker, and I'm asking this question again just for clarity. I know you're saying there are guidelines. A company cannot go to a worker and say you have to get vaccinated or you will be fired. There's no such threat that can happen, right?
The employer is, as I said, going to do a full analysis in relation to a risk assessment that needs to be done. Based on the makeup of that particular business, as well as the operational requirements, all these factors coming together, as well as, and I repeat myself here, what is the workforce made up of? If it's people with comorbidities, if it's people with constitutional objections and all that kind of stuff, if these things are factored in, and the employer comes to the decision, let's say, and I'm going to use the example again, either private healthcare or your public healthcare service, that there is a requirement that you must be vaccinated in order to operate within that environment. The employer is going to make that decision based on what is rational for that business. Within that context, the employers at the same time going to look at how they can accommodate any worker within that environment, whatever that means, and it is defined in this policy as well, or this piece of legislation. It says, if you can accommodate this person, these are the type of measures that you can look at. For example, can the person work at home as opposed to coming into work, and that sort of thing. If the answer to that is no, and you cannot accommodate the person, then the employer is going to look at, obviously, the last sort of resort will be, we cannot fit the person in, how do we take the process forward? And of course, where organized labor exists, it will be done in conjunction with organized labor as per the collective agreement that they'll have with organized business.
I totally get what you're saying. So it is basically them assessing the working environment. If the person doesn't want to get vaccinated still, they will try to look for an alternative position for them to work in, perhaps working at home. But ultimately, if they can't, this person will be fired. Now, when it comes to a constitutional right and the grounds that people were actually hired on in the first place, this was nowhere to be found. So the rights of the individual who does not want to be vaccinated if they work in a certain environment is now infringed on. So that is going to be an issue.
I think in this particular matter, the decisions weren't made within an environment in which people were going to be willy-nilly fired. And I don't think that will be the case. In this, in the development of this piece of policy, if you like, or this particular legislation, organised labour as well as organised business within the NEDLAG environment came to an agreement with government that this is the best possible way that we can move forward within the environment of vaccinations, remembering at the same time that vaccination, the process of vaccinations is far from finished or over, if you like, and that there's still a way ahead. It's not as if employers are going to make a decision within a vacuum and say tomorrow everyone's fired that's not going to be vaccinated. I think the process that was followed, and if you look at the way this piece of legislation is structured, I think it's well structured, wherein business and organised labour could come to an agreement and say, you know what, workers are going to get off on the fair side when it comes to this whole issue of vaccination. I don't think there's any intention for a unilateral letting off of workers, if I can put it that way.
All right, thank you so much for your insight and explaining that to us. It's, of course, a very important issue as we get more and more vaccines into the country. It's been slow, of course, but one day we'll get there, and we'll be arguing over this issue. Tibor Sana, of course, from the Labour Department.